This podcast is sponsored by Skylight Frame. Mother's Day is almost here. What are you getting her? Something that shows you care. Something that makes her feel loved. Something that won't stress you out. Something like the Skylight Frame. The Skylight Frame is the perfect gift. It's a touchscreen photo frame your whole family can upload photos to, from wherever they are in the world. It's a way to share with her all the moments that matter. It sets up in seconds. You can even make sure that it's already loaded with photos when your mom opens her Mother's Day gift. And her Skylight Frame can hold thousands of the treasured photos you share. It's an easy, heartfelt way for mom to stay connected with those who matter most. It really is the perfect gift. Now, as a special Mother's Day offer for our listeners, get 15% off your purchase of a Skylight Frame when you go to skylightframe.com/easy. That's SKYLIGHTFRAME.com/easy. Get 15% off your Mother's Day purchase now at skylightframe.com/easy.
Hi everyone, I'm Deb Flashenberg. Welcome to Yoga, Birth, Babies, a podcast produced by Prenatal Yoga Center. We will be diving into everything prenatal yoga, birth, and baby related, hoping to inspire, educate, and empower you through your journey into motherhood. Thank you for listening. Hi, I'm Deb Flashenberg. I'm your host for Yoga Birth Babies, and today I'm speaking with Anita Lambert. She's a registered pelvic health and orthopedic physiotherapist with a focus on women's health, specifically prenatal and postpartum care. So Anita and I dive deep into the topic of bodily issues and questions pregnant people and new parents have that may be ashamed or afraid to talk about. We're going to talk about incontinence. We're going to talk about kegeling. Was that the answer to all, or is that perhaps something you should stay away from? We're going to talk about prolapse, connecting to your postpartum core, a plethora of topics that I actually find really interesting. So if that resonates with you, or you're just simply curious about learning more information on Lifetime Learner, stay tuned. It's really a great conversation. I had a wonderful time. Before we get to that, just a few little things I want to touch base on. So we are smack dab in the middle of our spring New York City teacher training, an amazing group. I'm so excited to be working with these wonderful people. And we're already registering people for the fall. So everything's now on the books for next fall all the way through the spring. Caprice and I have 5 teacher trainings lined up. We're going to be doing our New York fall teacher training. Then we'll be back in Charlotte at Yoga One for the late fall. That is November and December. January and February, we're going to be going to Washington, D.C. I am so excited. We'll be at Willow Street Yoga, and then back into New York City for March and April. And then April and May, we're returning to Richmond, Virginia. We're going to be at Yoga Source. So 5 chances to study with us. We'll see if 5 turns out to be too much. You never know until you're there what's too much. But this year we did 4, and it was manageable and very exciting. So check out, if you're interested in our 85-hour teacher training, check that out. I have Who's Afraid the Pregnant Yogi is already up and running. It's my online course. Wonderful group of people. Thrilled to be working with them. And then last thing, if you're enjoying this podcast, which I hope you are, and you feel you want others to know about it, which I'd appreciate if you do, please leave a rating and review on iTunes or Stitcher or Google Play, wherever you're listening to this. It just helps get the word out more. I put a lot of love and effort into finding guests that I really resonate with and I'm excited to speak with, and then share that with you. So I just hope we can continue to share the love. And then the very last thing is, as you know, I love this podcast. It is truly a passion of mine. And one way to help keep it growing and moving is through donations. So again, it could be a donation of your energy by leaving a rating or review, or a monetary donation, which you can do on our website. Okay, I have rambled enough. Let's take a break and then we'll get right back into chatting with Anita. Enjoy.
With the Lucky Land Slots, you can get lucky just about anywhere.
This is your captain speaking. We've got clear runway and the weather's fine, but we're just going to circle up here a while and get lucky. No, nothing like that. It's just these cash prizes add up quick. So I suggest you sit back, keep your tray table upright, and start getting lucky.
Play for free at LuckyLandSlots.com. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18 plus terms and conditions apply. See website for details.
Hi, Anita. How are you?
I'm well. How are you doing, Deb?
I'm doing well. So it's fun to now connect with you on the other side of this whole world you're in, because last time I spoke to you, you were quite pregnant.
Yes, I think I was 37 weeks, with Jack when we had you on our podcast, To Birth and Beyond. So yeah, it's a little different now.
All right. So for our listeners, you might hear some baby sounds because Anita's juggling many things, including a child sleeping on her lap. But that's parenthood. So we're just going to roll with it. So I guess since I love talking about, you've listened to my podcast, listened to yours. I love that we've connected body issues, pelvic floor, abs, like where other people might be like shy away from that, I get incredibly excited. So I thought today's talk would go really towards the postpartum or maybe even some prenatal, but questions that people sometimes are afraid to talk about or ashamed, like incontinence, just some of that stuff that becomes the new normal that many people keep hidden, and then they can't ever seek support. So I think that's where we're going to go today. I'm so excited. I know people are like, she's excited to talk about incontinence. I am. I really am. So,
well, no, it's great to meet more people who are in the birth or health or fitness world who do want to talk about it, because I totally agree. I think so many people are going through it, but no one knows there's resources. And getting more people talking about just gets people to realize how common it is, but you don't have to actually put up with it.
Right, because a healthy pelvic floor is your birthright. It's not something that, we just have to kind of tolerate. But before we get kind of into the nitty gritty, let's just hear a little bit about you and how you got into the whole pelvic health and birth work.
Yeah. So as a women's health physiotherapist, and I know everywhere is a little bit different. So in the US, you'll hear physical therapist. Here in Canada, we're physiotherapist. So my practice is a combination of pelvic health, which is and can involve internal work and assessing the pelvic floor internally, as well as orthopedic or musculoskeletal physiotherapy. So that's addressing neck, shoulders, back, pretty much all the areas of the body. And my focus is really prenatal and postpartum and preparing for birth. So I've really niched down my practice. And I do have an athletic and dance background. So that's actually why I got into physiotherapy in the first place. And my interest over the years has come into, helping expecting and new moms and seasoned moms have, a comfortable and active pregnancy, confidence going into birth, and an efficient postpartum recovery so that they can get back to activities or sports or just day-to-day things without dealing with these, symptoms that we'll be talking about and kind of you already alluded to. And so it's a bit about my practice. And I do have 2 little ones. So I've got my 3-month-old right now, Jack, here with me, and then my 3-year-old Pippa. And I actually got into pelvic health before I ever got pregnant with my daughter. I had been a physio for a number of years, and what I was noticing was in my practice, I was actually starting to see a lot of pregnant clients. And when I got into my physiotherapy career, I also had done Pilates rehab training. So right from the get-go, I had kind of meshed together some traditional, what you would think as physiotherapy techniques, but also Pilates rehab, like clinical Pilates, and brought it together. And so I was seeing a lot of pregnant clients start to come through my practice and seeing these amazing just changes that they weren't having to deal with, pain, and even a lot of the pelvic floor symptoms we'll talk about. With the Pilates side, there was a lot of positive changes. And then I would combine that with manual therapy and different, fascial work and that as well. And so basically kind of over the years, when I was starting to see that more and more, I was realizing like how much fun it was working with them and just seeing those results. And one client in particular, I'll never forget, because I think she really kind of inspired me, was one of my clients who was pregnant with twins. And I had seen her after her first pregnancy, which was with a singleton with her son. And I had seen her for, SI joint pain, Achilles issues. And we had dealt with those and resolved those. And then she got pregnant with twins. And she was like, you know what, with my first pregnancy, it was like horrible. Like I had so much pain, so much pelvic girdle pain. I really want to avoid that this time with twins. So we did a lot of the Pilates rehab, combination of a lot of things. And she was just so surprised that how a twins pregnancy, she had little to no pain, was much more mobile, much more active compared with her first pregnancy. So that really, got me thinking, I really want to work even more with this population. So then I ended up kind of transferring to a women's health specific clinic. And this was in Toronto, Canada. And eventually I did my pelvic health, so the internal training, and then brought that all together, which really made my practice a lot more holistic, because I feel like that internal part was it just adds so much. And we'll talk a bit more about that. But to really know what the pelvic floor does can really impact how someone heals and just how they move forward with exercise. So I did that. And then I also did specific doula training for physiotherapists. So it kind of blended traditional doula training with the biomechanics and a lot of the physiotherapy techniques and brought it together. And then I brought that also into my practice, which was really neat. And I was able to really go even deeper into birth prep for a lot of clients. And since then, kind of never looked back. So my current practice is in Peterborough, Canada. We moved from Toronto a couple years ago, and it's called Holistic Health Physiotherapy. And then I also, as we talked about earlier, I co-host a podcast, To Birth and Beyond, with Jessie Mendel, who's a pre-postnatal fitness coach on the west coast of Canada. And then I'm in the midst of creating an online program just to help expecting moms understand, how to prepare their body, including their pelvic floor, for birth, which gives them a head start on their postpartum recovery. So that pretty much kind of sums up how I got into women's health and kind of where I am today.
Oh, it's exciting. You have so much going on. Can we look at, there was something you said, I don't think I had realized that I know you did doula work, but how do you apply your physiotherapy into the doula work? 'Cause I can imagine, we both know about, and I know I've talked to you a lot about this, like a balanced pelvic floor is going to affect fetal position. So do you do manual manipulation? If you're in the middle of a birth and you're like, okay, baby seems malpositioned, pelvis seems off. Now, again, I'm all about like scope of practice, but you have a different scope of practice because this is actually your thing. So you can cross a line where a lot of other doulas can't. So when you're actually at a birth, do you do manipulation?
So we could, in terms of externally, and I would love to get back to doing births. I haven't been to birth since actually before my daughter, just with little ones and being on call. That just hasn't worked with my practice currently, but I would love to get back to it. But yes, exactly. As a physio, we could. Now, even though I am a pelvic physio, so I can do internal work, during a birth, there would be no internal work happening. So it's more looking at external techniques, craniosacral techniques. Actually, at Jack's birth, one of my physio colleagues who did the physio doula training with me, she was our doula. So she was able to do in terms of some techniques externally, which were really helpful around my pelvis. So yeah, it kind of combines those. And also I feel it's a really neat way to problem solve, just because we're so in tune, not just with the pelvic floor, but just with the biomechanics of what is happening with the pelvis in all these different positions, that if we can figure out, okay, if baby, let's say, is in a position like an OP position, or a position that maybe isn't the most optimal during labor, what can we do to help encourage or give space for that baby, which I know a lot of doulas do as well. And so as a physio, there's just other training that we've done that we would be able to maybe think of other ways of also encouraging that.
This podcast is sponsored by Skylight Calendar. Let's be real. Running a household can be exhausting and chaotic. And finding the perfect Mother's Day gift, it's not exactly a no-brainer. Until now. The Skylight Calendar is the best way to organize the family and give everyone, especially mom, some peace of mind to enjoy the things that matter most. The Skylight Calendar is a smart, touchscreen calendar that keeps track of and manages the chores, dinner planning, groceries, and to-dos for the whole family. The Skylight Calendar automatically syncs each family member's digital calendars and displays them all together on one color-coded touchscreen. It even doubles as a digital picture frame, so you can finally share all those special moments that are just sitting on your phone. As a limited-time offer for our listeners, get 15% off your purchase of a Skylight calendar when you go to skylightcal.com/easy. That's SKYLIGHTCAL.com/easy. Get 15% off your Mother's Day purchase now at skylightcal.com/easy.
With the Lucky Land Slots, you can get lucky just about anywhere.
This is your captain speaking. We've got clear runway and the weather's fine, but we're just going to circle up here a while and get lucky. No, nothing like that. It's just these cash prizes add up quick. So I suggest you sit back, keep your tray table upright, and start getting lucky.
Play for free at LuckyLandSlots.com. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18+ terms and conditions apply. See website for details.
Mm-hmm. Yeah, it reminds me of when I did some spinning babies work about like the psoas and just the fascia. Yeah, so I just get excited to hear that. Totally off topic from what we're talking about, but you know me, I start talking birth and body and babies, and we go down a dark rabbit hole. All right, let me pull us a little bit back on topic. So you did talk, a bit about the work you do. It differs from traditional practice. Can you go a little more into that?
Yeah. So because, definitely with my practice, I've niched down quite a bit. So I only see women now in my practice. I would say pretty close to 100% of clients who see me do have a pelvic health issue on top of orthopedic issues. So knees and shoulders. So they could have, a shoulder injury, but also be having incontinence. So we can, address both of those. And I would say pretty much like 80 to 90% of my practice is prenatal or within the first 10 years postpartum. And then the other percentage of clients would be either before ever having children, or I even see some girls who are in the teenage years. We don't do internal, but there's a lot of external, a lot of education that we can do, especially, I would say that population, it's a lot of either incontinence with sports or pelvic pain. And then also women who are going through menopause. So that's kind of the either end of the spectrum, but majority I see are pregnancy and postpartum. And then, bringing the not only the clinical Pilates side to what I do, the acupuncture, but the pelvic health, so that internal component to really be able to assess the pelvic floor. Bringing that all together, I find clients really appreciate that because I can look at the body really as a whole rather than just, pieces or just from the outside. Mm-hmm. And then, with the physio doula training is great too, because bringing that birth prep in, I would say not every physio has necessarily that training, but also comfort level. Like, there's some days where every client I see that day is pregnant, and we're talking about birth preparation, and not everyone has that training or comfort level. So that's also something a little bit more unique, and it's great to see that area of our profession grow as well. Mm-hmm. So I'd say that's kind of where things are a little bit more unique with my practice. And I would say in terms of a pelvic health physio or pelvic floor physio, even around the world, everyone is a little bit different. Some are very, focused and isolate on the pelvic floor, whereas the training I did and the continue education I do, it's really looking at the body as a whole. So even if someone comes in, their main issue is I have incontinence, I am leaking urine, let's say when I'm squatting. We need to look at the whole body. If we only look at the pelvic floor, that's only one piece of the puzzle. And it may not necessarily be their pelvic floor is the main issue or the only issue. There's this whole pressure system that really you have to look at the whole body to be able to, decipher why they're actually experiencing the issue.
Mm-hmm. I 100% agree. So let's start to dig into what are the most common issues you see your clients come in to talk to you about?
Yeah. So I'll go through each one and just briefly mention, because I know some people may not be familiar with some of the terms that we'll talk about, just so everyone gets an idea. So I would say incontinence is a big thing. So that's, leaking urine, basically if you're not sitting on the toilet. A lot of people think, I just leak a couple drops. And it's like, well, no, that still is actually incontinence. But also leaking stool or gas. A lot of people are surprised that, that's even related to the pelvic floor, which it is. So that would be incontinence. And then also
you're saying people shouldn't release gas? Like, isn't everyone,
if they don't want to. So, yes. So that is the thing. You should be able to release gas when you want to. And it is something in terms of releasing it isn't a bad thing. But I do have clients coming in being like, I can't control when I want this to happen or not happen. Yes. Yeah. And that can be definitely pelvic floor related. And then also diastasis. And I'll just briefly mention this, but I loved the podcast you did recently with Solange and Lindsay. So if anyone's wondering, I would definitely say to go back to that episode. They did a great job talking about diastasis and up-to-date information around it. So traditionally, diastasis is thought of as a gap kind of between the abdominal muscles, which is very common in pregnancy and is actually very normal in pregnancy. And then looking at how this heals postpartum. And the big idea now, it's really around tension of that connective tissue between the abs. It's not so much about how far apart my abs are we going to close the gap is kind of the big thing traditionally. And the way we look at it now is the abs may not fully close, but that doesn't necessarily affect function. It doesn't affect necessarily the profile of your abdomen. So for more, like much more detail, I definitely would recommend that episode you did. I thought it was fantastic.
Thanks. And I feel like it's so new that the last couple years that this is the new understanding. Before it was like two fingers. Now it's like, okay, what's that linea alba feel like? So I get very excited anytime we can talk about that because it's a whole new acceptance that there can be separation, but we have to look at the integrity there. So I'm glad you like that. Thank you.
Yeah, I think it's one of the misconceptions right now is if there's space between the abs, it's a dysfunction or it's pathological, there's something wrong. And I think a lot of my clients kind of breathe a sigh of relief when I'm like, well, first of all, during pregnancy, third trimester, it is extremely rare not to have any space. Like it is a great, ability of our body to make that space for the baby. It's needed, right? But yeah, exactly. It's that the integrity of that tissue between the abs and how well, we can get force through there again. And then also in terms of prolapse. And so this refers to the bladder, it could be the urethra, the bladder, the uterus, the rectum starts to kind of lean in towards the vaginal canal, or it could also be the top of the vaginal canal starting to lower, or it can also be the rectum starting to lower with, outside of the rectum, basically. And we'll talk a little bit more about that after. Urinary frequency. So women come in and they're just like, you know what? I'm going to the bathroom like every 20, 30 minutes, and this is totally disrupting my day. So that would be frequency. Urgency, having to rush to the bathroom. Like you should never really have to rush to the bathroom. Occasionally, if you've, had a ton of liquid, but if this is happening every time you're going to the bathroom or even every time you're going to the bathroom, that would be considered urgency. Pelvic girdle pain. So that can be pain in the pubic bone, so in the front, the SI joint, the tailbone, the hips, anywhere around the pelvis. Extremely common I see actually in pregnancy and then also postpartum. Cesarean birth recovery. I think a lot of people don't even realize that that's a common thing we see as physiotherapists, but I have clients come in and they may have symptoms, so pain around the scar, back pain, incontinence, all the other things I've mentioned. But addressing the scar is really key because that can actually affect so many of those other issues. So most have no idea about massaging their scar or even just all the layers of what's underneath that scar. We just kind of see the outside. So that is very common. And then I'd say actually one of the really ones is internal pelvic pain. So pain with intercourse, pain with penetration, pain with, pap exams, putting a tampon in, Diva cup in. And I would say that's also very common that women just get told, you're pregnant, you've had a baby, it's going to just kind of be like that. Or some get told, have a glass of wine and relax, like in terms of for intercourse. And it's like,
I haven't heard that as a response. That's a little belittling.
Yeah, definitely have heard that a number of times that clients have been told that. And there's just so much more to it. And I think also to the misconception with the internal pelvic pain or pain with intercourse is that you've had a vaginal birth. And I would say I see a lot of women who actually have never had kids have pain with that, or after cesarean birth. So they never actually had the baby come out vaginally and they actually have pain with intercourse. So there's a lot of layers to it of why that can be an issue. And then I also see women who, now that pelvic floor is kind of catching on all over the world, I get clients coming in, they're like, you know what, I don't have any of these issues. I really don't want to have any of these issues. What can I do to, connect with my core, my pelvic floor? How can I get more in tune with this area so I can do everything I can in hopes to avoid it? And as physiotherapists, we can never say we can 100% prevent anything. But the fact that I do see that connecting to that area, especially before giving birth, can just have so many benefits on birth itself, but also postpartum. So I'd say those are the key things. And I do see a lot of athletes, whether it's clients who love going to the gym. I've seen a lot of CrossFit clients, which I think
don't even get me started on I have some strong feelings about that. A lot. Yeah.
And so working with athletes of all different levels and all different sports and dance, I love seeing dancers, especially with my background in that. Because as dancers, and I know with your background in dance too, like we were always taught, draw in, suck in, tight, like everything just needs to stay tight the whole time. And then as you get to know the core more, you realize, no, actually it's a pressure system. Like there needs to be ebb and flow in the system, and you shouldn't be clenching everything constantly. And same with my athletes, like my runners, teaching them, do not clench your pelvic floor the whole time you're running. It's actually not going to serve you, and it actually could contribute to why you're leaking. Or again, my weightlifters, strength trainers,
yogis. Let's put yogis in there, because there's certain schools of yoga where they just moola bandha it up to their eyebrows. Like we shouldn't be. And I was actually, something I recently got about a year ago, I got a Peloton bike, and I was listening to one of the teachers. She's like, you should always have your abs tight, like someone's going to punch you. And I'm literally yelling at a screen by myself, like, no. So I think there's a lot of misconception that strong and tight, where we forget it's about balance.
Yeah, it's balance. And that's the thing. If you think about any part of your body, like you don't walk around with like your bicep contracted the whole time, or with your quad contracted. Like even when you're walking, your quads and your hams, like there's so many muscles that are giving and taking and contracting and relaxing, that our pelvic floor and our core system is no different. It shouldn't be on 100% of the day. Yeah. Like it just doesn't make sense with the rest of the body. But you're right. We've kind of been taught that in many ways around exercise. And so now there's more, I'm glad to see much more education around, no, it's actually, that's not necessarily going to benefit you.
All right. So we started to talk a little bit about incontinence. Let's lean into that a little bit more. So we know it's common for people to have it, but we just don't want people to accept it as their new norm, their new life. Like, okay, I'm incontinent. I better always near a bathroom. So people deserve to have a healthy pelvic floor. So can you talk a little bit about why it shouldn't just be accepted, and then also what can people do about it?
Yeah, so it really shouldn't be accepted. So incontinence, whether you're, leaking when you cough or sneeze or exercise, or as you mentioned, rushing to the washroom, or a mix of the two, it shouldn't be accepted. It's basically a symptom that something is going on in our body, or that inner core system, that could be working better. Because, for example, if we had shoulder pain, we can conceptualize, okay, what is going on that's causing my shoulder to have pain? But when it comes to incontinence, we feel ashamed to talk about it, or we're just kind of told it's just, part of life, basically. And so it's just a sign that inner core system isn't quite working as well as it could. So that inner core system involves that diaphragm. If you think of a canister, so a diaphragm on top, the pelvic floor is on the bottom, and your transverse abdominis, which is that deep corset muscle. And so basically, if the pressure in that canister isn't kind of shared around equally, or able to have a give and take during those motions, so like a cough or sneeze, then you'll have some leaking. So sometimes it can be just as simple as reconnecting, to example, the diaphragm. And I know in terms of with yoga, that's obviously a big component. But as I'm sure you've seen too, and I see in my practice, not everyone necessarily is connected to their diaphragm or understands how it works. So or landing from a jump. So for example, clients I see who want to be skipping or doing box jumps or just any sort of jumping, if teaching them how to change that pressure in the system when they land could actually take away their leaking. And sometimes it can actually be that fast. So with thinking of that canister, For example, landing from a jump. So what should happen is when you land from a jump, our pelvic floor should lift and our diaphragm should lift too. So how that core canister works is as we inhale, our diaphragm lowers and pelvic floor should lower. And as we exhale, both should reflexively lift. And when that doesn't necessarily happen, then we could have leaking. So for some clients, I actually teach them how to exhale when they land from a jump. And that exhale can actually help reflexively lift that pelvic floor with their diaphragm, which could actually change their leaking. And sometimes that's kind of what we need to work on. But for others, there can be different components. There could be a weakness in the pelvic floor or how it's connecting to the rest of that canister. So working on that, something we call, you may hear core breath or core connection breath. So even just practicing that as you inhale and feeling like a 360 breath expand into your ribs. And as you're doing that, the pelvic floor should relax, which you don't get a lot of feedback on. I think people often think you should feel your pelvic floor do every bit of this movement, but actually when you relax your pelvic floor, you may not feel much happen. And then as you exhale, the diaphragm lifts and the pelvic floor. So you could be thinking lots of different imagery. It could be a blueberry at the vaginal opening, the rectal opening, thinking of, gently squeezing and lifting. You could be thinking of a jellyfish lifting. Some people think of a milkshake through a straw lifting vaginally. All these different imagery. I know with yoga is fantastic, for thinking of that imagery as well. So those are some of the ways to reconnect to those muscles. And if you want, I can actually include or send some resources or trips, even just some online programs, some individuals. So even Jessie Mundell, who's my podcast co-host, has some great online programs. Also Julie Wiebe, who's a fantastic physical therapist in the US, who talks about this as like a piston breath. If you think of like a piston on a car, when you inhale, it lowers. As you exhale, it lifts.
I think of a jellyfish, two jellyfishes working together.
Exactly. So I think and I do a lot of education like that with my clients, even before we get into a lot of the objective or like the assessment part where I'm looking at their muscles and joints and actually at the pelvic floor, because I think until you can visualize that core system and understand how it works, that it's going to be a lot harder to connect to it until you actually can do that. So I would say that would be a big part is, that core canister, that inhale, that exhale versus just clenching. So I'd say the big takeaway with incontinence too is just try to avoid the traditional just clenching your pelvic floor, gripping for dear life, because that actually in the end very rarely, if ever, actually helps incontinence. So understanding the pelvic floor should be able to relax and lift and engage. So it's about both.
Yeah, that answers my question about a lot of people just say like, oh, I'm leaking, I'm just going to kegel. I'm just going to kegel everything up. And we even tell our teacher trainees to be mindful of your language. Like, it's not about tighten, squeeze. I think there's a misconception about how to do pelvic floor work and then, again, how to use your pelvic floor, because as you're saying, sometimes it can worsen it. Like my teacher, Leslie Howard, talked about, she created more dysfunction because she thought, oh, I better just keep kegling, and she made it worse. So can you jump into that a little bit, like the difference between urge and stress and incontinence and why kegling may not be the answer?
May not. Yes. Yeah. So stress incontinence, which refers to a stress on the body versus like necessarily stress, we picture that kind of mental stress. So it's that coughing, sneezing, landing from a jump. So anytime there's kind of force on that core canister, and if that canister can't, again, distribute that pressure, there may be leaking. Or with urge incontinence, that rushing to the bathroom. And what can actually be the issue, it's not necessarily that the pelvic floor is loose and lax, which I think a lot of people picture, especially after having a baby. It can actually be that we over-recruit, or those muscles are constantly clenching. So in kind of a shortened position. If you picture like a bicep curl, if you're constantly in almost a full bicep curl and you're walking around with your pelvic floor like that, it needs to be able to lengthen and contract. So that I often see too. So for a lot of clients, actually step one we're doing, if in terms of specific to the pelvic floor, isn't necessarily how to strengthen, how to contract. It's actually how to let go, because their pelvic floor is used to living high up or always activated, over recruited. So I'm teaching them how to use their breath to let their pelvic floor almost come down to ground level if you picture a house. So then we can actually go up to the upper floors versus the pelvic floor living on those upper floors the whole time.
That's a great description. I think it's a great description. Yeah, we talk like an elevator kegel, but I think I like your house even better. Your house imagery. I might steal that from you. I want to move on to, I'll credit you, but I'll steal it too. So before I move on to my next topic of prolapse, is there anything else you want to say about incontinence?
Yeah, I would say basically what we talked about is just I really urge people not to accept that it just has to be part of life. There's so many, seeing a pelvic floor physio, but also there's just so many resources out there. And if you're just being told that you just have to put up with this, or the other end of it is you're just going to have to get surgery eventually, to know there actually is an in-between, that you actually can be working on it in various ways. Don't feel like you just have to kind of settle and this will be just the way life is.
I'd also add that inviting people to get to know the state of their pelvic floor, because if someone is really tight and gathered, engaged, they may not know that, so explore. Leslie had us do, and I did this training, on our own, internal work to feel like, is it tight? Or even think like, okay, when I put a tampon, does that hurt? So take a step back and try to figure, is my pelvic floor overly engaged? Is it not enough support? Because then we can then try to help ourselves. But I am firmly a believer in seek someone who knows it too. Once you realize it's dysfunction, go to someone that can help you. But if that's, if you're reading a book or you're in class and they're like tight, you might be like, pause.
Yeah. I would say one of the key, a lot of things with incontinence, it could be either end, there could be a lot of tension in the pelvic floor or not. But I would say if you're having pain with intercourse, or like you said, tampon, diva cup, anything internal, that's generally a pretty good sign that the pelvic floor is over recruited, or that there is some amount of tension there. So that can be a pretty good sign that you may need to learn to let go before working on the strength component.
Yes, I totally agree. All right, let's jump into prolapse. We're hitting all the fun topics today. Can you explain what pelvic organ prolapse is, as well as how common is it?
Yeah, so in terms of how common it is, it's 25 to 50%. So you'll hear different numbers, but it really does depend on age range as well. And I think a big misconception is a lot of people think it has to do with menopause, post-menopause. That's the only time you get prolapse, but actually it can be quite common among newer moms.
50%. That's a huge, I did not, wow.
Yeah.
Wow.
Yeah. So, and that's more in the age range more towards menopause and more kind of the newer moms, it can be around 25%, but it's that awareness of like, it does exist throughout the age ranges. And so it refers to, it can be the urethra, it can be the bladder, the uterus or rectum starts to lower kind of towards the vaginal canal, come towards the opening. And for some, it can come out of the opening. Now, I think the common thought is prolapse, unless I can kind of feel it outside of my body, that it doesn't exist. And a prolapse that has gotten to that point is more what we call like a grade 4 or a stage 4 where it's out. And there's lots of stages before that. So that's why as a pelvic physio, what can be great is we can notice these changes happening a lot sooner, and then be working on different strategies to help with that idea of being able to kind of manage, potentially reduce the stage. Not everyone reduces the stage, kind of depending, but managing symptoms and just how to do your activities, do your sports without necessarily symptoms of the prolapse. And then there also can be, a rectal prolapse is actually when the rectum starts to come out of the rectal opening. So that's more rectal prolapse. But a rectocele, you may hear, is when the rectum starts to lead into the vaginal canal, which is also called a rectal prolapse by some people. So just to not get confused, that there can be kind of those two happening. And another type of prolapse is called a vaginal vault prolapse. So this is where the top of the vaginal canal internally can actually start to lower towards the opening. This tends to be with more of a hysterectomy, because with a hysterectomy, when the space of the uterus, or there is a space because of uterus not being there, then the top of the vaginal space itself can start to lower. So that would, I would say, more be, post-hysterectomy, just because of that space being there. And some things you may actually be feeling with it. It could be, a heaviness feeling like something is falling out of the vaginal canal, even though you may look and you may not see anything. And that could be that it's an earlier stage. Or you may see a visible bulge at the vaginal opening. You may feel like you're sitting on something, or if you're using a tampon and Diva cup, if it doesn't stay in place, sometimes that could mean that maybe there's a degree of prolapse there, so it's not allowing it to stay in. And for some people, it can actually be a backache, and then we end up assessing, and there could be prolapse involved with that. So there's a lot of different, I like to talk about the different symptoms just because I think most people, again, think prolapse is if it's, if I can see it outside my body, I have prolapse, but that's quite a bit of a later stage. And so there's kind of 4 stages. So one is, it's slightly lower. 2, it's kind of halfway down the vaginal canal. 3 is it's quite at the opening or slightly past the opening, depending on the grading system. And 4 would mean that it's out. And it tends to be assessed, oftentimes traditionally, is in line and having the client valsalva, so kind of push down, bear down quite a bit, or cough. And those tend to be the ways it's assessed. But also it can be worth assessing in standing to see what it's like, because with gravity, that's going to change how the organ may sit. So depending on the client, depending who I'm seeing, depending what their symptoms are, their concerns are, we'll assess in actually different positions.
I had prolapse after my first, and I actually think part of it's because I was given some bad advice about using a binder. And the advice was make it as tight as you can. And I actually ended up adding Velcro to it to tighten it up, which clearly in hindsight, I'm like, well, that was bad. Because I remember all of a sudden one day walking and I'm like, something feels wrong. Like I hadn't felt it after the birth. And then a few weeks later, I felt it. And I ended up having prolapse. So I went to Pamela Morris, and she's the PT that I said, put me back together, like Humpty Dumpty. And she gave me a very regimented pelvic floor work, and she did internal, and I saw her for like 3 months. And it dramatically, and again, I was also further postpartum at that point, but it really dramatically changed the whole situation. It was, as a new parent, I was really taken, like, what's going? I was already thrown for a loop after having such a long birth and being a first-time parent to feel something was wrong with my vagina at that point. And then luckily I had the resources to connect with someone, but not everyone does. So that's why I really want to dive into this, because it can be resolved. I did remember her telling me that some people, they need surgery. So can you talk a little bit about some therapies that people may need? What, like, what would you do with somebody if they come in and anywhere from like 1 degree to 4 degree? Where would you go with that?
Yeah, so it's interesting because how I talked about with incontinence, that pressure system, with prolapse, a lot of it, we're looking at that pressure system. Because if you kind of picture that balloon, and for some clients, when they come in and we do the assessment, and I'm looking initially at breathing and posture and movement, and then we check internally and we find that there's a degree of prolapse. Then going back to some of those daily habits. So for some who, like, kind of like your binder idea of that constant drawing in, for some, it's like we start with changing habits. So especially postpartum mom, there can be a lot of trying to suck the belly in, basically postpartum, to try to, even it's very normal to, in terms of for our belly to be larger postpartum. And so a lot of women feel self-conscious. So there's constantly drawing in, and sometimes it's changing that pressure. So, educating, you need to be able to relax that, takes pressure off the organs, which can actually help prolapse as well and symptoms. Again, and we're looking at, there could be tension in the pelvic floor, because for some, when they discover they have prolapse or they feel the symptoms even before coming in, they're used to clenching their pelvic floor because they're trying to hold in their mind. They're like, I just want to hold everything in, so I'm going to clench. But then by doing that, they've learned to over recruit their pelvic floor. So that can be an area that we're working on. And yeah, I would say the biggest thing is the pressure system. So similar to incontinence, but seeing what, problem solving through what they need to actually work on with that. For some, a pessary can be helpful. So a pessary refers to there's different shapes, but it can be made of silicone, tends to be fitted by an OBGYN. But actually, different parts of the world, and Canada now, pelvic health physiotherapists, if you do specific training, can actually fit them. And you work together with a family doctor or an OB to consult and to make sure that the client is being followed up properly. But basically, what a pessary is you can fit it internally, and it can help support whatever organ or the area that is experiencing the prolapse. So for some, they wear it all the time. For others, they wear it specifically for activity or sport, or especially if you think of new moms, like I'm experienced right now with Jack, who is 3 months old, and I'm quickly reminded how much they weigh and how much, carrying a car seat. And I have a toddler who also sometimes likes to be lifted, and a stroller, and just all these. There's a lot of heavy lifting for new moms that I think gets dismissed or not thought of. So if you're dealing with prolapse, plus you're having to do all this heavy lifting, sometimes a pessary can be a great idea to also help along with kind of the rehab side of restoring things. So yeah, I would say basically the pressure system, potentially a pessary. In terms of for some who want in terms of surgery, or some women just get told like, this is kind of what you're going to deal with. And then eventually you're just going to have surgery when you're done having kids. And I think, again, similar to incontinence, there's so much in between. And for some, and depending on the degree of prolapse, they may decide they want to have surgery down the road. And there's not necessarily anything wrong with that. But what I would encourage is, similar to any other issue in the body, if you're going to have surgery, doing the prehab and the post-surgical rehab is so important to get the most out of that surgery. But also, again, talking to your surgeon about what, how common is reoccurrence of prolapse, because it can be quite common post-surgery. How long would a repair actually last as well? So that is something I encourage people to talk about if they're thinking about surgery at some point, that there's so many other things they can do conservatively to make that surgery outcome better. But also doing the conservative treatment, you may decide, I don't even need to have surgery. I don't want to have surgery. And so that's also a great part as a pelvic physio. I love being able to help women kind of discover that side of things too, trying to figure out, how can we reduce symptoms? The stage of prolapse may change as well. So there's so many lines of treatment or ways of helping and reducing those symptoms.
Yeah, I was told that when I stopped breastfeeding, things would change. And it actually did, because the estrogen level changes and things kind of rebuild themselves. So I'm glad that you touched on all that, because I've had students come in that are very concerned. And a few years back, there were all these commercials about, like, if you've had vaginal mesh and there's going to be a problem. And having had abdominal surgery for hernia, I could not imagine having prolapse surgery. It just sounds a little overwhelming. So I'm glad there are many options and people don't need to jump to surgery.
Yeah. And like you said, everyone is individual. And I think sometimes people get told, one or the other, like, surgery should never be a part of it, never be an option, like only do conservative, or the other way, exactly, kind of like surgery is going to be your only option. Don't bother with conservative. And I just think every person is individual needs, individual wants of what they want, kind of out of their symptoms or what they need for their body. So it's kind of exploring all the options, but no conservative treatment can be extremely effective with changing symptoms regarding prolapse.
Yeah, I think people need to know. I actually thought at one point, because when I first went to Pam and I saw when she told me about the prolapse, I'm like, oh my God, I thought I was going to have surgery. And I was so happy that I was able to work with her. But that was just me. Like, surgery is not my game, but I totally respect those that want to. All right, last little bit before we start to wrap up. Let's talk about the postpartum core. I had a student come in, I think it was 2 weeks ago, and we were doing transverse abs, we were doing pelvic floor. I have them do pelvic floor work with their hips elevated, because that's what was taught to me about draw some of the weight off the pelvic floor to try to find those muscles. And she's just like, I have no awareness about anything. Just like a Mack truck could drive through my vagina. I have no awareness. So can you explain a little bit about how someone can just start to find that connection to pelvic floor and abs postpartum?
I would say starting with the diaphragm. Like that's where I find the breath is so key, because what we talked about with that core canister, pelvic floor and diaphragm work together. So if someone, and again, with pregnancy, our diaphragm tends to get pushed up, right? Like that baby gets priority of our abdomen. So if we haven't become familiar with that diaphragm and that kind of 360 rib breath, if we don't have that working really well, it actually is harder for our pelvic floor. I notice a big difference that with my clients that when we're doing the internal assessment and I'm having them find their pelvic floor, if they're not connected to their breath, their pelvic floor is so much harder time activating. So actually what they'll go home with is actually relearning how to breathe, and that rib breath, that 360 breath, they come back and without even trying, their pelvic floor is actually more connected and they can feel it. So I would say number one is that rib breath, 360 breath, get reconnected to that. A lot of people find if they're in neutral spine, so that little bit of curve in the low back, I know there can be that can be a whole discussion on its own. But being in neutral spine, I find clients tend to have an easier time. And it's just because of the length that the pelvic floor sits in with neutral spine. It tends to be a little bit easier to activate versus, with the bum tucked under and flat back, or, exaggerated the other way. But I always mention with that as well, the key thing is we don't live life in neutral spine. We don't do everything in neutral spine. You need to be able to learn to activate in all different positions. So that might just be where you start, but that's not the end. So I'd say that would be the biggest thing. And then how I talked about before, that idea of that core connection breath, that as you inhale, that relaxation, as you exhale, any of the imagery that we talked about. I love the jellyfish idea. And for some people, even sitting on like an exercise or a birth ball, when you start to get that movement, sometimes you can feel a bit of the perineum lifting. I'll have some people actually put their hand under them on their perineum to feel it get a tactile response. For some people, putting their hand a little further back, even around the tailbone, because where the pelvic floor connects, when you exhale and lift, you'll actually feel a little bit of a lift around your tailbone too. So I would say that's a big part too. And that's not something we tend to be comfortable with, right? Like if, a lot of people, when they're coming to see me, they kind of expect that we're going to be talking about their pelvic floor and, whether palpating that externally or internally, but not everyone expects that, going to yoga.
But we use that. Sometimes I roll up a yoga strap and I put it at the perineum because it's not that comfortable, and you're very aware of it. So they can actually then feel when they're drawing away. So it's exact same idea as like the tactile, like I need actual feedback.
Yes. Yeah. Some tactile feeling that way. For others who are comfortable in terms of internally, even palpating their pelvic floor themselves, right? I mean, it can definitely be hard at the end of pregnancy when I talk about perineal massage with clients. If it's something that they do want to do, at that point, it tends to be if they have a partner, I'm like, it's going to be more it'll be easier for your partner to do it. It's harder for you to reach that area. But either before that time or postpartum, that can be a great way to actually feel, am I feeling, again, the pelvic floor should be a squeeze and a lift, which a lot of people don't know that there should be a lift with the pelvic floor, but that's what you're going for, is a squeeze and a lift. So even internally palpating that. So, a lot of different ways I would say to connect. So diaphragm first, get that rib, the diaphragm and that rib access, and then layering on the pelvic floor, and then the TA, that corset muscle, which it shouldn't be a corset as in when you engage, it should be a really strong squeeze, but there should be some gentle drawing in from the bottom of the abdomen up as you're lifting the pelvic floor too. So that's kind of a whole other layer to it.
I love hearing all this. I'm like, yes, we're doing the right things with our students. Yes. It's always reassuring. All right, we're going to take a quick break. When we come back, I would love for you to offer a tip or piece of advice for new and expectant parents.
With Lucky Land Slots, you can get lucky just about anywhere.
Dearly beloved, we are gathered here today to... Has anyone seen the bride and groom?
Sorry, we're here. We were getting lucky in the limo and we lost track of time.
No, Lucky Land Casino, with cash prizes that add up quicker than a guest registry.
in that case, I pronounce you lucky.
Play for free at LuckyLandSlots.com. Daily bonuses are waiting. No purchase necessary. Void where prohibited by law. 18 plus. Terms and conditions apply. See website for details.
And we're back. All right. So as we start to wrap up, especially because this is your world, you just had a baby, there's probably a lot rummaging around your mind. What tip or piece of advice can you offer new and expectant parents?
So I would say, and kind of specific to the pelvic floor and core, it's never too late, because I think that's really key to know. It's never too late. If you're listening and you're pregnant, to start now, to reconnect or to learn to connect to these muscles, because connecting before, it happened for myself, but also I see it in clients. When you understand your pelvic floor and core and connect, it can help with your birth and it can help with your postpartum recovery. So I would say if you can start when you're pregnant, that's a great time, even before you're pregnant. But also if you're newly postpartum, learn how to connect. And depending how your birth went, you may be very aware of your pelvic floor in terms of there may be issues going on. So to know that you still can reconnect and there can be a lot of positive changes that can happen is really key. And then also if you're pregnant or postpartum and you do have symptoms, that there can be change. Because I think just so many are just like, okay, this is the way it is. As we talked about, so many women, I mean, there's so many commercials in terms of you're going to have light bladder leakage. I feel like that's the big thing right now. You hear light bladder leakage with everything, day-to-day stuff, but, and a lot of different products that can be used. But I think, again, reconnecting and pelvic floor physio, a lot of great evidence towards it as well in terms of helping to resolve or reduce these issues. But again, seeing individuals like yourself, like yoga instructors, fitness professionals who are also training up-to-date information, definitely worth connecting with them.
Perfect. That's a great piece of advice. And where can people find your work, including your podcast?
Mm-hmm. Yep. So in terms of my physiotherapy practice, you can find at holistichealthphysio.com. I'm also on Instagram quite often and Facebook at Holistic Health Physio. And then our podcast is called To Birth and Beyond, and you can find that at tobirthandbeyond.com. We're also on Instagram, To Birth and Beyond Podcast, but also iTunes and Stitcher.
Hey, you guys do a lot on Instagram. I always see you guys pop up in the stories. I'm very impressed with your social media.
Thank you.
You're welcome. Well, I want to thank you for your time. You know, this is my thing. I love talking pelvic floor. I literally started counting. I'm like, I think I have 5, and then I lost track, just because it's a topic that's fascinating and that I think we need to keep unpacking and uncovering. So thank you so much for your time.
Yeah, and thank you so much just for bringing more awareness. Like I've heard so many of your episodes, like I said, with the diastasis one, but you've done so many before that. I just think what you do is helping so many expecting and new parents in areas they didn't even know that they actually could get help with. So thank you very much.
Oh, you're welcome. All right, enjoy your afternoon. Take care. This has been an episode of Yoga Birth Babies, produced by Prenatal Yoga Center. You can catch us on Facebook, Twitter, Instagram, and Periscope. I'm Deb Flaschenberg. Thanks for listening.
With the Lucky Land Slots, you can get lucky just about anywhere.
This is your captain speaking. We've got clear runway and the weather's fine, but we're just going to circle up here a while and get lucky. No, nothing like that. It's just these cash prizes add up quick. So I suggest you sit back, keep your tray table upright, and start getting lucky.
Play for free at LuckyLandSlots.com. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18 plus terms and conditions apply. See website for details.